Hi, I'm Shannon Clements, and I will be presenting on magnesium. So what is magnesium? Well, it's an essential mineral that the body needs in order to perform daily bodily functions. And so it's one that our body doesn't produce on its own, and so we need to consume it through the foods that we eat. Right here we're looking at the recommended dietary allowance and upper tolerable levels of magnesium. So right here we have children 1 to 3 years old, they have 80 milligrams, while looking at men, they have 420 milligrams. So that's a big difference. So depending on your age, you're going to want to get a specific amount of magnesium daily. So you're definitely going to want to pay attention to what life stage you're in, whether you're, a pregnant female, you might need 360 milligrams compared to the regular female, 19 to 30 years of age, that would need only about 310 milligrams. For the RDAs, there wasn't an established RDA for infants. So they only had the adequate intake established. So what that was for 0 to 6 months was 30 milligrams. And then for 6 to 12-month-olds, it was raised to about 75 milligrams that they would need of magnesium. So just something to keep in mind. And also for infants, there wasn't an established upper tolerable level. But for children 1 to 3 years of age and 4 to 8, it was between 65 and 110 milligrams that they would need, that they wouldn't want to exceed. And then for all other people, the upper tolerable level, regardless of age or gender, was set at 350 milligrams. So what are the major functions of magnesium? Well, it actually does quite a bit. Magnesium is essential to complete over 300 enzyme systems in the body that regulate reactions in the body. So this includes protein synthesis, nerve and muscle reactions, making bone structure, maintaining blood glucose levels, transporting calcium and potassium through cells, and then maintaining blood pressure regulation. So this picture over on the left shows magnesium coming in and calcium being able to leave the cell. So food sources for magnesium are very common. You can get them in a lot of different foods, which is good news because that will help us stay away from having a deficiency. So some of those food sources include green leafy vegetables like spinach and kale. It also includes whole grain cereal. You can get magnesium in nuts, peas, soybeans, regular beans, fortified foods. You can also get it in avocados, fish, and red potatoes. And if you're not sure how much magnesium is in the food that you're eating, just look on the nutrition label and you should be able to see the amount of magnesium that you're consuming in your food. Like I said, it's not likely that you would get a magnesium deficiency because you can get it so easily in foods. There are, however, risk factors that would make you more likely to get a magnesium deficiency. So that would include, increasing age, parathyroid disease, having Crohn's disease, kidney disease, or if you abuse alcohol, or even taking antibiotics might put you at a higher risk for magnesium deficiency. So early signs of loss of magnesium deficiency include loss of appetite, nausea, vomiting, fatigue, weakness. But if you're experiencing those symptoms, that doesn't necessarily mean you have a magnesium deficiency. Those are common symptoms for a lot of things, including, the flu. So don't just jump straight to a magnesium deficiency if you're experiencing that. But prolonged deficiency symptoms can be much worse than, those early symptoms, and you'll definitely want to check out if you might have a magnesium deficiency or something, or definitely talk to your doctor if you're experiencing any of these things. But those prolonged deficiency symptoms include numbness and tingling, muscle contractions, cramps, even seizure, abnormal heart rhythm, personality changes, hypocalcemia or hypokalemia, which are just low calcium and low potassium in the blood. And so this can get pretty serious, so you don't want to allow yourself to get a magnesium deficiency, so you'll definitely want to get that in your diet, or if recommended by a doctor, to get it through supplementation as well. Okay, so we've talked about magnesium deficiency. We've talked about, the functions of magnesium and the food sources. So let's talk a little bit about toxicity. In healthy individuals, having too much magnesium shouldn't cause any major health concerns because your kidneys will excrete the excess, but it can bring some uncomfortable symptoms like diarrhea and cramping. But if you do have a toxicity, what would put you at higher risk for that would be over-supplementation, or if you have kidney failure, you might also get a toxicity. And those symptoms would include nausea, vomiting, hypotension, urine retention, even depression, and cardiac arrest. And so you definitely don't want to over-supplement and get toxicity. So like was recommended earlier, you can easily get magnesium in your diet. And so just watch out for over-supplementation. So we've talked about its functions, and one of the functions of magnesium is in metabolism to stabilize ATP. It's also used to aid in calcium metabolism as well as in glucose metabolism. And so as shown in the picture on the right, we have magnesium bound to these phosphates on the ATP. And so what it does is just, like I said, to stabilize that molecule. And so without it, your energy wouldn't be too stable, and you wouldn't be able to function well. So really grateful for magnesium and the way it's able to do that. So some interesting things I found about magnesium were its uses in medicine. So magnesium sulfate is used to treat eclampsia, which is it's a condition in pregnant women where they have seizures and sometimes coma from the seizures. So there's a study done in 2009 where they used magnesium sulfate and found, compared to diazepam and other seizure medications, and found that it was actually much more effective than those other seizure medications to reduce the seizures. Although it wasn't exactly clear why the magnesium sulfate had this effect, but it was clear that it was effective in treating it. So that was interesting. Magnesium sulfate is also used, and has been used since the 30s, to treat severe asthma attacks, which is also very cool. And then I'm sure we've heard of milk of magnesia, which is used to treat constipation, as well as, when you have too much acid in your stomach, it's used as an antacid. So just interesting that magnesium has such a big role in medicine today. Further on that, they're still doing more studies to find more ways that magnesium can be beneficial to our bodies. So from Science Daily, I found this article talking about how magnesium chloride can be used to treat depression, and might be, a more cost-effective treatment. So that was exciting. This was a study done by the University of Vermont, the Clinical Research Center there, and they had 112 participants consuming about 248 grams daily of magnesium chloride, which, if we remember, is less than the UL. So they were taking, a responsible amount of magnesium chloride as suggested by doctors. And it was interesting. They used, over 100 participants with mild to moderate depression. And they found that it was just a short 6-week period study, but they found that this was actually very effective in reducing those symptoms of depression and anxiety in their participants. So that's exciting. And then Emily Tarleton, who was one of the researchers, even said that this was one of the first randomized clinical trials looking at magnesium for being a possible treatment for depression. And so we can definitely hope to see more of this in the future. In the future studies, finding out if this is actually something that might be a viable treatment for depression. So as I mentioned, in the future there's a lot of research to be done on the medical uses for magnesium. It could help lower costs of current treatments. As studies come forward, we might know more about magnesium-specific functions in the body. So definitely a mineral to keep your ear out for as time goes on. The take-home message that I got from this is eat a variety of foods. You can definitely get magnesium in your diet, unless recommended by a doctor for specific conditions or by a dietitian. It's not necessary to supplement. You can definitely get the amount that you need in your diet. But do make sure that you are getting that recommended amount in your diet by knowing the recommended amount for your specific age and gender. Thank you so much for watching. These are my references.